Hi, everyone. I see people logging on. Welcome. Good afternoon. We are here with the next page, Screen Time and Young Children's Development with our friends at LiveMore ScreenLess. As people are logging on, I know it takes a couple minutes here. If you could use the chat function and introduce yourself, your name, your organization, and just as an aside or a logistical piece, make sure that when you're using the chat function, you're selecting all panelists and attendees or everyone, because the default means that only the people here on camera are going to see it, and we want everyone to be able to see who's all here. So again, introduce yourself, your name, your organization, and we'd love to know what the young kids in your life like to do on screen. So here at Reach Out and Read Minnesota, we're all about books and reading and sharing books together, but also recognizing that it's been a long 18 months and that kids are using screens, and we'd just love to get a sense of how the young kids in your life, and specifically the group we work with is typically 5 and under. What do they like to do on the screen? So kids you work with, the kids you are a medical provider for, or your own kids, and grandkids. So for me, I have a just turned 6-year-old and an 8-year-old, and it's a struggle to keep them off of YouTube. That might be universal, but they do like to watch shows and play games, and at least some of it's academic. So again, use the chat to say hi. Feel free. We want this to be interactive. So feel free to comment, to provide suggestions or ideas or things that are relevant to your, something that jumps out at you that's really relevant to your own work during the entire presentation. And then, as those of you who've been with us before, we always leave plenty of time for Q&A at the end. So in that case, if you can, try to use the Q&A button to submit questions, and that will allow all of the panelists to see it, and we'll be able to try to get as many questions answered as we can. Again, go ahead and feel free, if you're just joining us, introduce yourself in the chat. I'm going to go and move on to introductions. I'm Chris Hoplin. I'm the Executive Director of Reach Out and Read Minnesota. And I think we have really a wide variety of people joining us today. So I know some of you are really familiar with Reach Out and Read, and some of you are probably brand new to us. So I'm just going to spend 2 minutes kind of talking about our organization and what we do. So who we are. We believe that books build better brains. We have t-shirts that say that on it if you want to go to our website and purchase one. Just a plug for that. We're a pediatric early literacy program that seeks to give young children a foundation for success. We currently are in 283 clinics around Minnesota. We have books available in 17 different languages, and we serve over 170,000 kids in a typical year. So this infographic describes our program really well. The program itself is pretty basic, but it works. It's backed by many years of evidence. So the way it works is at each of these 283 and counting clinics, we have more clinics joining us each month. The young child, so starting at 6 months, sometimes even earlier, sometimes from birth or from the 2-month visit, they go and they visit their doctor for their well child visit. And at that visit, the doctor brings in a book with them, a new book, developmentally appropriate, in there as much as we can in the family's home language. And they give it to the child or the family, and they use that book as a prompt to talk about how reading and singing and sharing stories together builds their baby's brain or their young child's brain. So the idea is the family goes home empowered to read and learn together. And then there's what we call a dosage effect. And so this happens over and over again at every well child visit until the child turns 5 years old. The 5-year well child visit is their last Reach Out and Read visit, with presumably them going to school after that. So that's just a very quick overview. Obviously, if you're interested in learning more about Reach Out and Read, you can go to our website, lots of information there. We'd love to have you be involved with us in some way. All right, I'm going to move on to introductions. We are so excited today to have our guests from LiveMore ScreenLess. I'm excited to hear more about the work that they've been doing over the last year and a half. I'm introducing KK Myers and Marie Hampton. Marie brings expertise in health education, youth development, and program evaluation, with 25 years of experience working in urban and rural communities, as well as in higher education. As a co-founder of LiveMore ScreenLess, Marie serves as Director of Strategy and Health Promotion. KK brings experience in secondary and adult education with 25 years of experience teaching students in public and private schools, as well as leading professional development workshops for educators across the country. As LiveMore's Director of Youth Engagement and Education, KK brings a high level of authentic credibility to her work as a veteran educator. And I'm also going to introduce Gigi while we're on introductions. Any of you who have been to one of our other virtual events in the last year and a half, you'll recognize Gigi. Dr. Gigi Chawla is our medical director here at Reach Out and Read, Minnesota. And she is also the chief of pediatrics at Children's Minnesota. And if she looks familiar, even though you've never been to one of these before, you can catch her on, you might have caught her on TV on WCCO. She has a segment. She also has a column in Minnesota Parent Magazine. And you may have seen her on the cover of Minneapolis St. Paul Magazine's Top Doctors edition this year. So Gigi's gonna.
Yeah, I actually want to know how many people drew a mustache on the magazine, you know, like my kids did.
Oh yes, you're famous, Gigi. All right. Well, I am going to. Hopefully, this all works. I'm going to hand this over remotely to KK here for them to control, and you should be able to take it away.
Hello, everyone. I'm Marie Hampton, together with my co-founder partner, KK Myers, and we're really pleased to be with you this afternoon. Thank you, Chris. Thank you, Liam. And thank you, Dr. Chawla, for sharing the stage with LiveMore ScreenLess for this next 45 minutes or so. Thank you also to all the participants out there. I know lives are very busy and you've carved out time to attend to this issue, and we really appreciate your participation today. I just have to share, a big fan of Reach Out and Read, and I still have the book that was given to my, he probably was 3 or 4 at the time, now 17-year-old. The book was called Yoshi. And when I asked Lars the other day if he remembered that book, he said, yes, he did. So thank you, Reach Out and Read, for giving us hours of enjoyment through books. Really fabulous program. So our organization is a nonprofit. We started a couple of years ago, and our mission is to advocate and promote digital well-being for and with young people through a collaborative and comprehensive community approach. And I really view today as an example of how we are collaborating with Reach Out and Read and doing this in the community approach. So we are research-based, data-driven, and youth-inspired. And here's our definition of digital well-being. So it's seeking balanced, intentional, responsible use of technology in order to enhance how we engage, communicate, relate, feel, focus, and learn. We are not anti-tech. We are all about balance and intentional use of technology, and we are about screening well.
I'll just jump in here, Marie, yes, and add sleep. And I like that you paused at that one, because that certainly is an emphasis for us today.
Absolutely. So we know the pandemic has just ramped up all of our experiences on screens and use of technology, and it had to. And so we're grateful for that. We're also hearing and seeing folks talking about the need to recalibrate and to reassess. I know we're still dealing with the pandemic, but we're also entering this time of heading back to offices, back to schools. And so how might we engage with technology in a more healthy and balanced way That's the work of our organization. We want to be a real resource and tool and guide for all Minnesotans who are interested in digital, what we call digital well-being. So our goals with you today is to understand how screens are affecting child development. And then we're going to bring in and sprinkle throughout a lot of expert recommendations, as well as tips and tools that parents can use, that pediatricians and healthcare professionals can use, and parent educators that you can pass on to families that you engage with. And then if we don't have time for all your questions or you have a follow-up, please do not hesitate to reach out to us. We'll provide you with information about how to contact us. And we also have a resource sheet. So it'll be a digital PDF that lists all the research we're talking about today, books we recommend, articles we recommend, tips and tools. So you will be getting that information at the conclusion of this time together or later this afternoon.
Oh, Chris, I don't know how to go back. It looked like it just jumped ahead. Thank you. Perfect. Well, thank you everybody for those introductions, and Marie for shaping up the time that we have together. So as I was introduced, I'm KK Myers. Just a pleasure to be with you this afternoon. And I want to begin by having you look at this screen and just think to yourselves, what is it that you see on the screen, and how is the image on the left similar to the image on the right? And I imagine as you gander at these photos, you are seeing a similarity in the colors. Perhaps you're even attending to what you might be hearing, the bangs and noises that could be emitted from both the slot machine and our devices. These two are related beyond simply the colors and the sounds. They too are related from the behavioral psychology and the variable schedule of rewards that are the drivers behind the construction of a slot machine and of digital media. We know that it's easy to motivate behavior by putting easy triggers in one's path. So thinking about trying to reduce food intake, we would put more fruits and vegetables maybe in our refrigerator than we might put chips in our cabinets. The same is true with our devices. So thinking about technology's easy triggers, it's a swipe, it's a click, it's a press of a button. And all those are designed for easy access that reinforces that variable reward schedule. And that makes it very challenging for us as adults, as parents, as caregivers, as educators, because we are up against very persuasive technology. We have to go back 2 slides again. Thank you. The slot machine is known as the crack cocaine of gambling because of its addictive tendencies. It is solitary, it is rapid, it is continuous, and it is based on that variable reward schedule. We don't know when the 3 cherries will appear. Smartphones have been called the slot machines in our pockets for the same reasons. They can remove us from community. They can create community, but we know we can also be caught being in isolation on our phones. Is rapid and it is continuous. Infinite scroll and autoplay are 2 examples of how continuous it is to be on our devices. Okay, so let's see if I can get this moved ahead. Okay. Got it. So focusing us here is, like Marie mentioned, we're not anti-tech. This is not to be doom and gloom. But if we look at what Dr. Richard Fried is saying, what we are most concerned about is how it is that screens might be replacing healthy child development. So what we would really like to do is look at what are those protective factors that can be put in the way that can support that healthy child development and not be displacing or replacing that healthy development. We might want to consider, instead of framing our conversations around screen time, which is not such an easy idea to talk about, because not all screens are bad, not all times on screens are bad, because look at us all here, we're on screens. Hopefully this is productive and invigorating, but what is it that screens are replacing? And we do not, and so attending to that healthy child development. So we'd like to take a minute to engage with you and to have you put in the chat, what healthy activities do you see being replaced by technology? And we'd like you to focus on the children that you serve or that are in your lives. And that can simply be a one-word answer. And I think that Liam might share some of those out as they kind of rapidly come across our screens.
Yeah, I'll just share as they're coming out. One says outdoor independent play, spending time outdoors, lots of comments about being outdoors, play and parent interactions when parents are browsing phones, playgrounds, engaging with others, communicating with others, playing independently. Thanks for everyone. These are great answers. Keep them coming. Being bored, that's a big one, right?
Yeah, you're really calling out so many factors that we'll touch on in a bit too with our dimensions of well-being. But I like too thinking about that parents or adults on phones are also replacing some of that healthy interaction with their children as well. But we don't want to demonize that it's just the children that are on their devices, because this really is something that has captured all of our attention.
Yeah, talking and skills of reciprocal discussion, that's a big one. Playing with toys, imagination. Dr. Grauman says kids don't know how to use scissors to do crafts. She sees this a lot in pre-K. And then some comments about playgrounds as well.
Right, thank you, everybody. So here we are, let's do something about this.
So the previous slide, with the images of the children, if we could go back to now, sorry, this one, there we go. So this is all to just remind ourselves, and in some of the chat responses, you mentioned environment, you mentioned the playground as a place where perhaps parents are on phones and maybe not engaging with their children. I think we've all probably seen examples just by looking around, and just think about the environment. Think about how the environment either supports or does not support healthy screen use. Think about your home and how that looks and how that plays out. Think about the doctor's office. Think about schools, and think about, so what is it about our physical environment or policies or practices that either support digital well-being or put up barriers to digital well-being? And just kind of keep that in the back of your mind. As we move through the presentation, we'll be talking about different research studies and tips and tools, and some of them are very tangible and are related to the environment, and some of them are more like thoughtful, intentional approaches to how screens are managed throughout the day. So on the next slide, you'll see the American Academy of Pediatrics is noting that overuse of digital media puts your children at risk. So sleep, number one issue that we always focus on when we do presentations with parents. Delays in learning and social skills are another one. There's obesity. We know that a lot of times when devices are used, there's just a lot of sitting that's involved. And then behavior problems, particularly if children are viewing more violent content that can kind of spill out into behavioral problems. So it's pretty well established. There are a lot of correlational studies, some causal studies, and definitely enough to really alert all parents and pediatricians and educators that we all need to play a role in this complex issue in really gearing towards more balanced intentional use. So we have provided some tools and tips for you, including the American Academy of Pediatrics guideline there. Some studies that have been shown on the next slide. This is a study that was done out of Calgary. It's turned up some evidence to support limiting screen time for babies and young children. So there was a longitudinal study of over 2,000 mothers and children led by Sherry Madigan, a psychologist. And the result of tracking over 5 years, they found that more time per week spent on screens at ages 24 months and 36 months was linked directly to poor performance on screening tests for behavioral, cognitive, and social development at 36 months. So it was a clear indication that excessive screen time at those earlier years seemed to precede some developmental difficulties.
Maria, I'm sorry to interrupt. I took over the slides just to make it a little less complicated. So Maria and KK, if you need me to advance, and I haven't yet, please just say go forward.
Okay, Chris, go forward. Thank you. Oh, excellent. Thank you. So there's a phenomenal resource if you're really interested in the research. You know, technology advances so quickly, it's really hard for the research to keep up. But there is an article here, which is included in your resource sheet, that's out of the American Psychological Association, that really summarizes the research, talks about the correlational studies, some of the causal studies, what we can kind of take away, what we know to be true, to impart information to parents and educators and pediatricians and the like. So children under age 2 don't learn from screens as well as they do from live interactions. We know that to be true. We know that co-viewing media, that parents sitting side by side, co-viewing, engaging with their children as they're watching media is really important. And that can sort of mitigate some of the downsides to solo viewing. We know that from years and years of research that television viewing is correlated with obesity in youth. And as we look to adolescents, we know that meeting sleep, screen time, and physical activity guidelines is associated with the best mental health outcomes in teens. And KK and I, with our work, are really focused on young people and knowing that those trends in mental health are not going in the direction that we would like. So those are the key findings.
Thanks, Marie. On this slide, we feature Dr. Dimitri Christakis, Director of Child Health, Behavior, and Development at Seattle Children's Research Institute. And here he is featured in a documentary called Tethered, We Are the Experiment. And on your resource page, we have a link for you to be able to access viewing of this film. And it's just an honor that Marie and I, along with our board chair, Jessica Wong, were also interviewed for this documentary. And it is just, Dr. Dimitri Christakis is certainly a leader, along with Dr. Gigi Chawla, in this arena. And then one of the things that he contributes in this documentary is research that he did with 3-year-olds and a longitudinal study then looking at how their screen time affected their attention at age 7. And he set out to find out if the rapid pace of what it is that's being viewed on screens is influencing attention. And he was able to see that we can overstimulate the brain, that can lead to attention problems And we certainly know that really worldwide, there is an increase in ADHD and attention problems. And he attributes to the allure of the touch screen and the contingencies, sort of that persuasive design that is there, to leading toward a potentially addictive device. And we can go to the next slide. I mentioned that we have looked at all areas of well-being. As you were putting things in the chat, we were seeing that you yourselves were touching on the various ways that screen overuse and misuse is affecting the healthy development of young people. And we have created this dimension of well-being to look at these 5 areas. But in our limited time here today, sort of what we'd like to do is overlay on top of this, and just to say that one of the biggest protective factors we'd like to focus on is protecting sleep, because we know that sleep does reach in and affect all areas of well-being. And we can go to the next slide. So we'll ask for just, it looks like this slide didn't come up in the right way. So let's try the next slide. For some reason, we're not seeing that. So we'll go back and I'll just let you know. So no audience participation here, but I'll just say to you that in 2017, the Netflix CEO, Reed Hastings, said that the real competitor of Netflix is, drumroll, sleep. And then he goes on to say that Netflix is winning. So with that in mind, it really is to say that one of the biggest protective factors that we can focus on for well-being and for the healthy youth development of young people is to consider how screens can delay sleep and impact the quality of sleep. Okay, we can move on. And that's our number 1 tip. And to think about a healthy routine. And when we engage with high school students, we have them think about what were those routines they had as children, as babies, going back to that time, and then thinking about their routines now. And that's a really eye-opening exercise for them to think about how the way that they approach sleep has changed, and to encourage them to bring back some of those healthy activities. On the next slide, we have just a framework that we have based on Diana Baumride's authoritative parenting model. So I'll just try to quickly go through that as we frame up more ways that you can be talking to parents about healthy engagement with screens. So in the next slide, the Daniel the Tiger study, perhaps you're aware of it. It was a 2016 study of 127 children ages 2 to 6. There was a control group that didn't watch Daniel the Tiger, a group that watched 10 episodes where parents did not engage in conversation, and a group where the parents did engage in conversation. And their findings showed that when parents engaged with their children around those episodes, that empathy increased. So starting first with asking parents to listen and attend to their children. As Marie mentioned, co-viewing. Know what it is that young people are viewing.
As KK and I are moving through these next sets of slides, we're going to be providing resources. This is a really great example of one, and also trying to think about, as your role as educator or healthcare professional, what's easy for you to kind of remember as you're talking with parents, engaging with parents. And one of those is the 3 C's. So for parents to think about their child, what their child's vulnerabilities or assets, or just thinking about that whole child, the content of the viewing, what are they seeing on the screen? What are they engaging with content-wise? And then the context, where does that take place? And it's just a really great, easy thing to think about as a parent in assessing how their child is using digital media. And there's also a really great tool that's, if you go to the Tap, Click, and Read website, there's an actual tool that parents can complete. And by completing this tool, it kind of increases awareness around how screens are used in the home, where they're placed. So by taking this quick little quiz, parents can get a sense of where they're at in terms of screen use in the home. So they might answer questions like, are you leaving the screen or TV on when no one's watching? Is media replacing calming routines that could help during bedtime? Do you have moments when you're jointly watching television and having opportunity to discuss what you're watching? Are screen media used during meal times in a way that impedes conversation? So if we think about early on in the slide presentation, Dr. Freed's orientation toward his worry about screen activity replacing healthy activities. So also thinking about that question, is this screen activity replacing some healthy interaction, this communication between parent and child, or time spent outdoors? So this is another tool that you can use to just increase awareness among parents. And the next slide, please.
In our next framework is limit, and that can be obvious, although in a pandemic, boy, did we struggle with that. And here I just want to highlight a really fascinating study that I'm hoping that you will look into when you receive our resource page. It's from a survey published, or research published in January 2021, so very recent, out of Penn State. And the title is Risk and Protective Factors for Frequent Electronic Device Use of Online Technologies. And we don't have time to go into this much at all, but I do just want to highlight what they found to be those protective factors for parents as they looked at over 10,000 young people. And they came away from the study of kindergarten through fifth graders that those protective factors that parents can use are the parent-child interactions, regular physical activity, we know how beneficial that is, and then consistent sleep routines. But beyond that, there are some really compelling findings in that study about those risk factors, again, that I suggest that you look into if you can. On the next slide, just again, continuing with this idea of limit, the CDC has put out another sort of interactive site, if you will, and it's in 3 different age groups, so maybe a little bit beyond what our focus here is, but from 8 to 18, and looking at screen time, and then what are some of those activities that young people can be engaging in. And so here's just an example from that tool that encourages physical activity and limiting screen times, removing TVs or screens from bedrooms, and then encouraging other types of fun. And sometimes we forget that we might need to retrain. How is it that we can be spending time outside of using screens?
Another great resource that many of you are probably familiar with, but really good to bring to parents' attention, is the family media plan that you can create. It's an interactive tool, so you fill out information about your family, answering questions, and then a media plan is then created tailored to your family's needs. It's also available in Spanish. And there's a whole host of really great resources from the American Academy of Pediatrics for parents who are trying to manage this. And we know this is like the #1 challenge for parents nationally and probably internationally, but we know from many surveys that parents are feeling guilty, they're feeling stressed, they're feeling overwhelmed. And so if, as educators, as healthcare professionals, if we can kind of lift that burden a little bit by providing some tools in a very non-judging way, so that parents can have some ways that they can get started. And the family and media plans are really a great way, particularly for young kids, to get started. As your children get older and get to middle school and high school, it's important to have more conversations where you're jointly agreeing on the rules around screen use in the home, so that there's this more sort of give and take and collaborative approach. That's for older children. But for the young ones, really important to set up those healthy boundaries early on.
So we've gone through listening and limiting, and we can't stress enough the importance of parents being role models. And again, this is no easy task, and we know that, but so important to stress that the way children learn is by watching what their parents are doing. And so just stressing that importance of parents as role models, knowing that the perception of media is influenced as much by what parents say and that what they do not say. So again, really encouraging parents to be doing that co-viewing, be asking about what are on screens and how children are feeling about their time on screens. We really do like to stress that it's important to ensure that we're engaging in the child's emotion around screens, because often it doesn't feel good. And then I'll just direct you to one of the research links that we provided, and the title is Technoference, and the interference and interplay that's very complex and happening when a child misbehaves and then a parent compensates with a screen, either to the child or on their own. So I'll just direct you to that. And we think this is just something easy for you. Oh, on the next slide, something really easy for you to take with you from Anya Kamenetz's book, The Art of Screen Time, to capture that when we talk about limiting screens, it doesn't have to be that we're closing it all down, but thinking about enjoying screens. How do we use them for enjoyment? Not overdoing it, and then engaging with others while we're on our screens. And then the next and the last of our framework, it brings us to love, just the importance of parents showing that affection and warmth and attention, and that can go a long way for that nurturing, safe environment. And then lastly, to wrap this up, is on the next slide, we have from the Children's Screen Time Action Network, a handout that's called Be Tech Wise with Baby. And it's just a reminder of the importance of that parent talking with the baby and engaging as much as they can visually. They're looking at that child and that language development, right? Bursts in those first 3 years, and the importance of parents attending to their baby and less to their screen.
KK, just want to add that this resource is readily available to print out. It's in Spanish and English. It's a 2-page, front to back info sheet, and it really was designed for pediatricians to hand to new parents. And so it's a tool that can be used with new parents, and then they are going to continue with the series by creating Be Tech Wise with toddler, and they're going to move up the age range. So just a really great resource to get the conversation started with parents of babies.
And you can go to the next slide.
So we're going to wrap up here, hopefully have a few minutes for questions. We just real briefly wanted to show our model for working in community, working with schools, after school programs, and hopefully you see yourselves in this circle with the child at the center and looking at all of the supportive adults around that child. How can you support the digital well-being of children? And then we also, on the next slide, just super briefly, we're so happy and pleased to have received a grant support from the state of Minnesota through legislation that we will now be creating a deeper resource library online and creating a network of organizations. So reach out and read. We're looking to you to be a partner in this collaboration and other similar organizations so that we can have a louder voice and we can communicate together and coordinate some activities. We have training for adults and educators, and then we have peer training. So we're super excited. We have 2 years of funding to really lift up the work and to engage with others who are interested in and aligned with promoting digital well-being. And lastly, here's our website, and that'll be on the resource sheet as well. And then just a real big thank you for your time and for your attention this past 45 minutes or so.
Thank you, Marie. Thank you, KK. That was great. And I think a really good mix of really understanding the research and the science, and also actually offering really practical resources and materials. And there were a few questions that popped up in the chat, but please feel free to continue to ask questions either in the chat or the Q&A, and we'll get to some of those. But I'm gonna hand it over to Dr. Gigi Chawla right now to say a few things.
Thank you so much for such a great presentation. It's such a great tie-in to our mission at Reach Out and Read, because we do see that there's a substitution, right? When I walk into an exam room in clinic, instead of kids bringing out their books, they're on their parents' phones, or sometimes on their own digital device, even when they're super young kids. So I love this concept of how do we marry these two ideas together, that it's just so important that we're navigating the benefits of reading, the benefits of bonding, and matching that with the benefits of using less screens. So really appreciate you bringing this forward today. Thank you.
Thanks, Gigi. And I'm going to stop the share now for the questions section. It sounds like people have some questions about the resources. Yes, we will send out the resources with the recording after this is over. So we'd love for you to share within your own networks, both the recording and the resources that KK and Marie have put together for us. One question that came up, I see a couple, but one that came up, and this could be for all of you really. It says one of the 3 C's was content. Do you have any guidance on how to pick content for young kids, especially when there's just so much out there?
Well, I can go first. You know, I tend to really rely on, for content in screens for kids, content that is as educational as it can be. And I tend to rely on the old tested and true. So things like Sesame Street and such, where it's really a very educational framework, repetition, and also gives as much emotional content context as possible. The other screens that I'm, especially during the pandemic, that we really leaned into even for young kids was FaceTime, or that ability to stay connected to grandparents or other loved ones in that fashion. But I'd love to hear what our guests think too.
Well, thank you. I'll take this from kind of an educator's perspective. And we know that the gamification of what is taking place on screens is really influencing kind of that persuasive design. So thinking about YouTube influencers that might be disguised as a child's show, but behind it is all sorts of advertisers and pulling children to want things to become consumers. And when we think about the gamification of educational tools, and right now the estimate on educational apps is it's about a $60 billion industry. So there is no way that we are vetting that these are actually educational. So be wary of the bells and whistles, the distractors, the things that might look like we are learning, but really young people are there to earn a token, to get to the next level. And all of a sudden what we think is educational is really being gamified. And I'd love to say more about that, but it's a whole other webinar, I think.
Yep. Thank you. This question would probably be to either KK or Marie. It says, I love the peer education element part of the plan for your organization. Can you share more about community partnerships you are working on for peer support elements, especially for preteen and teen ages? This is from Thea, who is at Health Partners and works in community partnerships. So it's a great question.
Well, hoping that Marie will add to this too, but we are just so excited about peer education, and we really believe that the importance of young people, as you saw in our mission, is we are digital well-being for and with young people, and for them to be supported and to be leaders. So we have piloted our peer education training, and we'll continue to do that. And we are partnering with Faribault schools right now, and another pilot of that. And then we just hope through this state grant to be able to grow that. And I don't know, Marie, if you can say anything more.
Sure. Just we're just really excited about this model as an evidence-based approach to public health. It's like there's 30 years of research in higher education, the use of peer education to promote health. There's not as much that is available for the high school age. And so we're really excited about borrowing this model. And we know, particularly with this issue, KK and I want to step back, and we want to put young people in front to talk to other young people about the issue. They don't want to hear it from someone our age. While we have lots of wisdom to offer, we really want to lift up and promote young people, do education, co-create. What KK didn't say is the peer education training that she worked very closely with our youth council was co-written by young people. So it's really, that's living our mission. We are promoting digital well-being for and with young people. And we're just really excited to, we've piloted it once, do it again at Faribault, and really expand and scale up as we are able.
Thank you. Another question for any of you who might know. It says, is there any comparison of current screen concerns or effects to the advent of televisions in every home? So back when all of a sudden everybody had a television in their home. Now everyone has.
I'll take a stab at this. I don't know. We certainly know that it's faster, right? We reached Pokemon Go and 50 million viewers in, I think it was 2.5 weeks. I think it maybe took 37 years for that level, for televisions to be in, have 50 million viewers. So the rapid pace of having to adjust to that is extreme. But it also, we don't have, I guess what I would like to point to is the background of persuasive design behind the screens. So similar question could be a phone versus a cell phone, a television, a radio versus our phones, that thinking about what is that behavioral psychology behind our screens, the gamification that keeps us tethered and shows addictive tendencies toward the use of those screens.
And then just to piggyback, just the portability of having our phones with us at all times, very different back in the day when we had to go walk over and turn the TV on, or, the cartoons ended sharply at noon. And so everyone just went outside. Right now it's 24/7, it's accessible, it's easy to use, and just the ubiquitousness of this. But I do want to point out, KK mentioned the Netflix and has mentioned the onset of the iPhone. We're not that far into that. Those innovations happened around 2007. It's really not that long ago when you think about it. And then you think about the rapid acceleration, and we're just trying to catch up, right? We're like, trying to get a handle on this. And so just to sit back and realize that this technology really hasn't been with us for very long, but the amount of change that has resulted is astronomical, right? It's changed so much about the way we communicate with one another, how we relate with one another, how we pursue entertainment and engagement. So it's really astounding, the changes that's happened in a relatively short period of time.
Yeah, I might add that there, some of the physical effects that we see on kids, whether it's obesity or, empathy or some of those pieces, it's been such a short amount of time that we may not have enough to really be able to say what all of that is. I think there's been some recent information out that, the use of screen time at a very early age is correlated with nearsightedness for kids. And so will we be now seeing more kids with glasses at an earlier age, and what are the long-term effects for their progeny as well?
Thanks, you guys. This is a question specifically for Gigi. What are pediatricians seeing at their well child visits when it comes to this topic? Are many parents concerned? Is this something that gets brought up a lot?
Yeah, I think, at all of our well child visits, it is a topic that we always want to address, from a safety standpoint, as much as from a health standpoint. And so really, I think we've got a lot to further develop as far as the behavioral and the developmental aspects of how this could impact kids. I've recently been spending a lot of time worrying about how I see those families anytime their kid is feeling a little bit agitated or at a transition, they just hand the phone over to the kid and you're going to be fine, take this and that'll calm you down. And it's okay for kids to have a little bit of a struggle and to learn that self-regulation skill and be able to transition. But I do see kids having a harder time with that and worry how that translates beyond the clinic visit, beyond their toddlerhood times with their parents into the school years and other. So I think we see a lot of what you're talking about and are at that crux of a perfect place to really instruct and reconcile and offer opportunities for change.
Mm-hmm. Great. Thank you, Gigi. I am just looking here. Just some comments. One of our now retired pediatricians says, one thing I heard frequently as a pediatrician when I would talk about screen time was, I only let them watch educational shows, but the kids were still spending hours in front of a screen. Another comment, going back to the peer activity, someone said that when their children were teenagers, they had a powerful activity with peers to discourage smoking with a group called B Team. So, and that it was a really effective way to use peers for educating. So just kind of going back and supporting what your plans are. I am not seeing any other questions right now. We will also include the chat. There's lots of good comments and information and resources in the chat. So that'll be part of what we send out with the recording and resources. So I think we'll wrap it up now.
Chris, can I just add one more final comment?
Mm-hmm.
We, as an organization, we really value listening. And one of the first projects we did was bring high school students together for a focus group to better understand what it was like for them to navigate the 24/7 digital world. And we created some educational videos just with young people speaking about this. We know young people want to speak about this issue. It is pervasive in their lives. They don't like it. They like having breaks. They like to get away from it, but they feel like they can't. So it's so critical as pediatricians, healthcare workers, educators, parents, to really ask our young people and our children what their experience is like online, on devices, how are they feeling, to really start having conversations and keep those conversations going, because it's complex And it's creating a lot of stress in our child's lives. And it's important for us to really provide that space and opportunity for them to talk about it.
Great.
And if I could just add on to that, add one more thing as well, Chris, and kind of adding on to what Dr. Chawla mentioned about that dysregulation, seeing in the clinic that teachers are seeing that as well in the classroom and trying to regulate device use. And certainly the pandemic has increased that dependency on devices. So just bringing us back to that whole community, really whatever role you play, what is it that you can do to engage in that conversation? Because it moves from the clinic into the classroom, into the home, and all of that is affecting their well-being. So beginning with a question, how are you feeling with your screen use might be it. And like we said, focusing on sleep, but really just encouraging everybody to use your position to engage in a conversation. And we hope that we can continue to partner with all of you to really elevate those conversations.
Gigi, anything else? Any final comments you have?
No, I was just reflecting a little bit on, the teenagers and how much anxiety and mental health concerns we've really dealt with, well, all along, but then definitely through the pandemic. And it's just, sometimes screens really have been the thing that makes it so much worse for kids, with comments and just, feeling left out at times. And it can be overwhelming. And at other times, it really has been the thing that gets them through. And so what I've really appreciated from your conversation today was, what is that balance? What is that balance for each individual family, for each kid, and putting that into the context of a healthy lifestyle.
Yep. Thank you. Well, thanks to all of you for joining us. Please look out for an email with the recording, chat, and resources. And I know that Marie and KK would love to engage with you as they move forward with their work. And so, you have their website, and feel free to reach out to them directly or us directly if you have other questions about Reach Out and Read Minnesota. Thanks all, and have a good day.